My name is Dr. Tushar Mehta. I'm from Canada, and I did my residency there in family medicine. I've also practiced addictions medicine, and I've mostly practiced emergency medicine, or what you call A&E in some countries. I have an interest in international health, and I do work in India and a few other places. And on top of that, I have a strong interest in plant-based diet and health. So when I say plant-based diet and health, you can also say vegan diet and health. And I'm here on behalf of Hina Modi and plantshift.com. Let's talk a little bit about plant-based diet and iron and calcium, okay? So many people think that you can only get these calcium from milk and iron from animal sources, okay? You gotta eat your meat to get your iron, okay? Now I'm gonna tell you that that's not true. First thing you should do if you're going to be or you're going to be more of a plant-based person, or you're going to be vegan, yes, there are great health benefits, but like anything else, no matter what you do, you should be educated about it. So what are the foods that contain your iron and your calcium, okay? So the best thing to do is go to Google and type vegan iron sources, vegan calcium sources. Lots of great things are going to pop up. It's going to show you things about beans and lentils and whole grains and dark green leafy vegetables, kale, broccoli, prune juice, molasses, cream of wheat, raisins, nuts, seeds, all containing both of these things. Some extra things that you can know about that. Soya and tofu can also have a lot of calcium and iron in it, okay? Now, if you are taking food with calcium or iron, you absorb more if you concurrently eat something that contains vitamin C. All right, so if you're having some fruits and vegetables along with your lentils and grains, then you absorb more of the iron from those sources. Oranges, citrus fruits, yes, they do have vitamin C, but all kinds of fruits and vegetables actually have vitamin C. Red peppers do, broccoli does, kale does, and many other fruits and vegetables also. Especially if they're orange and red, they probably have a lot of vitamin C in them, okay? So it's not just the citrus fruits. So that's number one, okay? So eat those things concurrently. If you're having beans and rice, make sure there's veggies in there as well, all right? Now, two superfoods to mention, three superfoods. One, soybeans. Okay, soybeans have a lot of iron and calcium, very large amount. The next is kale and broccoli. They have a lot of iron and calcium, but they have built-in vitamin C in the same vegetable, so it's all there in one. So great to also eat. Okay, check your iron once in a while. If you are low in iron, then you may have to take a supplement. Now, again, in my family practice, in my emergency medicine practice, you see a lot of people who eat full meat diets, but they still have iron deficiency. It's very common, especially in women who are having their menstruation. Okay, and so people may need some extra iron. There is some evidence that people having too much iron and too much calcium that may be linked to part of the heart disease that they're getting. So maybe too much animal protein, it's the iron in there that may be part of the problem. It's also the animal protein saturated fat, but this may also be an issue here. Okay, so you can get too much iron and you can get too much calcium as well. There's a lot of studies that have come out. Now I want you to look into the reference list that I've provided in the description box. Go there, download the link, scroll down, look at the section on dairy and calcium and on bones as well. A few studies have come out, as I've mentioned already, that the dairy consumption increases prostate cancer, and there's some about breast cancer as well, so there's some more cancer studies. But also, there's a bunch of recent studies that have come out from various European groups and large studies showing that people who have more milk, have higher consumption of milk, the highest consumption of milk, actually have more fractures and broken bones in their later age. This was kind of a shocker to a lot of people. Now there's earlier studies that show this, but it wasn't sort of confirmed and validated. Now these new studies that are better designed, bigger studies, coming and showing us the same thing again. So kind of confirming stuff that was already in earlier, older studies that were, a little bit less reliable, but now it's more, solid. So why is that? We don't always know the mechanism of why that is, but people consuming the most dairy have more fractures. This is a lot of false advertising on the meat, on the dairy industry. You see all kinds of industry ads by dairy showing that it causes stronger bones, but the truth is that they have more fractures. A lot of evidence for this. Okay, take a look at those studies. And conversely, there are studies that showing that people who consume more soy have stronger bones. So soy is a food that is confirmed to have stronger bones. Now, a lot of the benefits of soy may extend to other beans and lentils as well. So maybe they also confer the added strength in bones and reduce cancer rates. But just they haven't been studied quite as much as soy. Soy, there's been so much interest in sometimes paranoia about it, that it's been highly, highly studied. So the results in humans have always been very positive, okay? So, but other lentils may have similar properties. The other factor that's shown to increase bone strength is consuming lots of fruits and vegetables. Those people who consume more fruits and vegetables have less broken bones. So like osteoporosis is often diagnosed just by a bone density test. They do a bone density scan and you kind of see the test there, okay, the result. However, more important than just the number on the test is whether you get a broken bone or not. Okay, so fragility fractures, osteoporotic fractures, fractures especially of the hip and the spine, compression fractures of the spine are a tremendous source of pain, and hip fractures are also a lot of pain, but also a lot of death from hip fractures. You know, people getting their operations, being laying in bed for a long time, getting a pneumonia and dying, getting a blood clot or a heart attack because they're laying down so long. That's not a good thing for an elderly person. So those eating more soy, more fruits and vegetables also have less fractures, and there's a little bit of evidence there for whole grains as well. But those are the major things, okay? So look out for those studies as well that I've told you about, and that's a great tip for your health. What else do I want to mention about this topic? The other thing I wanted to mention about fractures is that, okay, people on if they're on a starvation type diet and they're not getting enough protein and calories, definitely in those cases, some dairy might help because there's calcium and protein that people are on, you know, a very low amount of malnutrition. If they're having malnutrition, then the extra protein, calcium is going to help them. But when we're talking about these studies that I just mentioned, it's the people who have already an adequate diet and now they're having more dairy. Those are the ones that get more fractures. So a malnourished person, if you're from a third world country, giving somebody milk is definitely a good thing. Don't deprive that person of milk. If they can get it, they need it, okay? But if you can get soy milk and you can get the protein and calories from other sources, especially us in developed countries or even places like China and whatnot where they do a lot of these studies, if you're already getting enough protein and calories and whatnot, then the milk causes more harm and perhaps soy causes more benefit. Okay, so let's contextualize that a little bit, because I don't want to say that a malnourished person shouldn't get milk. Okay, because I work in third world countries, I'm very aware of this. All right. Now the other thing is that, again, in the sort of populations that are well nourished, us in the West, we're not starving or anything like that, added calcium and added vitamin D don't seem to cause any benefit for our bones, our bone strength. Okay, so extra calcium, vitamin D is probably not something that's necessary for most people, okay? Get your calcium through your food. Use the whole grains, the lentils, the fruits and vegetables that have calcium, and maximize on that. Now there is a caveat. Vegans, there are some people who are vegan, okay, they're plant-based, but they're not getting enough calcium. They're not eating enough beans. They're not eating enough lentils. They're not eating enough whole grains. They're not eating enough kale, broccoli, and the green leafies that give them the calcium. So they actually are deficient in calcium, and those people actually may have a higher amount of fractures too. There's one study from the Epic Oxford showing that there's a small amount of extra fractures in the vegan group. However, when they looked at the vegan group and subdivided it into those who have a good diet with enough calcium and those who have a poor calcium intake, they found that the guys with the good calcium intake were fine. It was specifically those vegans who were not eating all the right foods getting a increased amount of fractures. So what can you do if you're vegan to get enough calcium? I also already mentioned some of the foods. One more that I should mention is soy milk. Soy milk, when you have soy milk commercially available, it's usually supplemented with calcium. Check that. If there's 250 or 300 milligrams of calcium in the food, that's good. The studies show that you need about 700 to 1,000 milligrams of calcium per day. If you're getting more than that, then calcium supplements, dairy, vitamin D don't have an extra benefit, okay? So just make sure you get enough. If you're vegan, make sure you're getting enough. And once you do, you're going to be fine, all right? And quite possibly watch out for the dairy intake. Now, one more thing to mention here is that some people have very low amounts of vitamin D. If you're a dark-skinned person living in a climate where there's not a lot of sunlight, maybe you need a little extra vitamin D. Okay, but overall, it's not shown to be much benefit. A few years ago, there's a few early studies showing that there could be a benefit of extra vitamin D, but now we find that there's not a lot of benefit when we have the bigger and better studies. Okay, but there's this subpopulation, dark-skinned people living in a place where there's low sunlight. Okay, so that's one thing. And the other thing is elderly people. Elderly people who are the frail, fragile, elderly person who are in bed a lot, in a nursing home. They don't go outside. They don't get any exposure to sunlight or very little exposure to sunlight. Perhaps vitamin D will be good for them.